blocks.
This is good. Okay, so I'm going to show you another technique with how to use the cups. You can do them before bleeding if you'd like as well. It's whatever you feel comfortable. You have to build your own groove. That's how I like to call it. I like to call it groove. So one pump. One pump. This is, you could help target those fatty deposits or fat pockets. Bring blood to the area. We're gonna do the other cup. We're gonna do it. For my girls who have the suction cups, mine are a little bigger than what you ladies probably have. So we're gonna do it just like that. How's the cup feel up here? Not too tight?
It's good.
Good, okay. So cupping should never feel painful. That's key right there. Cups should feel good. Like you feel like the blood is flowing into that area. It should never feel super tight. It should never feel very painful. You should never feel sharp pain whatsoever when you're cupping. If it's too painful, that means you probably have too much suction, or you may need to prep the skin first with a prepping tool to desensitize the skin. Because again, when fascia tissue is beyond bound, that means it's super restricted. So when you lift beyond bound fascia, is going to feel uncomfortable. So you want to first bring blood. If you have that type of skin, for my super sensitive clients, if your skin is, if you're beyond bound fascia, get in there with a paddle blaster, a face blaster, and stimulate, a master blaster as well, and stimulate that blood flow. So then when you do the cupping, it should feel nice and smooth. Okay, so I'm going to release the cups. Good, just a little bit of color, not insane. Okay, go in there with a blade, and of course, I feel it all in this area right here. Sartorius, she's already slightly bruised here. I don't know if you can see her leg. So I'm going to avoid that area. We don't want to get into an area where it's trying to heal. So we're just gonna go around that bruise. You can also drive blood to the bruise to help it heal with whatever tool that you decide to want to bring the blood flow in. But let's avoid that bruise for now. The lateral aspect of her leg feels great, nice and smooth. It's all inside her leg. So that means we're going to externally rotate to get into this area right there. She's got a little fat pocket in the hip. She has a little discrepancies with her hip. And we're gonna go in there with a paddle blaster. Nice and soft. We're not jamming the tool into her hip, into her thigh area. This area here is super sensitive. If you ladies do cup your inner thigh, please use caution because it's very sensitive. How does that feel, Jai?
Feels good. It's tender.
Good.
It hurts,
tender,
but
yeah.
it's good.
Feels good? Okay. And we're going in very soft. The paddle blaster within itself has a weight to it, so there's no need for you to add more weight. You just glide the tool because it already has a small weight to it. Okay, and then I'll go in with a massage tool. Again, you have your Big Daddy, your Mini 2, your Mini 1, and your original Fasciablaster that you can go in. And you can go from side to side just to trick the body a little bit. Go against those muscle striations. Or you can just take it up and down, just like this. And I like to use a scooping method. If you can see me, I scoop like this. That's great for fat deposits as well. Then, nice and red. I'll go in there with a refining tool. Get the nugget. So a lot of ladies have fat pockets in this area. So the way I like to address it is I like to pull the skin up a little bit here. As soon as I feel that fat pocket, this is where I stop, and I use my nuggets to get in there. I like to start with the wider side. Your nugget does have a thinner side, a pointier side, and a wider side. So I like to start with the wider side first. And you pull up the skin, pull up the skin, pull up the skin, and stop where you feel the distortions in that fat pocket. And work yourself up. How did that feel?
It freaking hurts, but I like it.
And I am going so soft. I am not jamming this nugget. I am going super, super light because I know how tender this area is.
But I could feel it too.
Yeah, she feels all the bumps and the pebbles. These feel like pebbles. And I got stuck right in here. Nice adhesion in here. And then if you want, if you feel comfortable enough, you can then go in with the pointier side of the nugget. I like to hold the nugget between my pointer finger and my middle finger. And just get into that area. And then we flush. That's all we're looking for. We're looking for that nice red flush look, giving the body the signal to come and repair and take away any waste that it may be collecting in there. And let me remove the cups. Yeah, no marks. You see that, ladies? No marks. If your foot is facing inwards, you want to work on the medial aspect of the gastroc, and you want to work a little bit here in the front of the tibia. Okay. You can go in there with a little face blaster because the claws are small. It gives you the ability to work into little detailed areas like that. Or if your foot faces outwards, that means you want to work on the peroneals and the tibialis anterior. Nothing crazy. We are just feeling.
You were asking me if it hurt, right?
Yeah.
It hurts.
That one hurt, yeah?
Yep.
Okay, then we... This is the bad knee, right?
Yeah.
So this is a perfect example of those little fat deposits that collect in here and here. You want to clean it up and take any scar tissue you already had there to begin with. But our bodies, once there is an incision, it will create scar tissue again. So therefore, this fascia tissue is holding on to nice little fat deposits here. And again, it was due to her posture, the way her foot placement. So it will collect in this areas right here. So we're going to take the face blaster to prep the leg. And I'm just using an upward, downward motion into that knee. It's funny because Joyce came to see me for aesthetics. She's like, fix me! My cellulite's out of control. My knees are non-existent. My hips hurt. My feet hurt. I just had knee surgery. So it's an amazing transformation. She's come a long way. Dedication and consistency, right? You would say those are the keys.
Yes.
Consistency and just do it. Dedication.
Find the time and just do
And
it.
find the time to do it. Exactly what this challenge is all about. The new year, new you. It's about putting yourself first. Because without putting yourself first and taking care of yourself first, there's nothing else. No one else can depend on you. You want to be a better you in every way, shape, or form. So, bringing blood into this knee. A little tightness up here. Into here. Okay, once I prep, I massage. This is all part of prepping the knee. I like to work the entire leg when I'm working on certain joints because it's all in unison. It all works together. And if you go back to your book, Ashley explains that fascia is like a bed sheet. When you put it on the bed, it lies nice and flat. When you go and tug it in a corner, everything else shifts. So this is why I like to work the entire extremity. So her fascia, no matter where the discrepancy might be, I'm also addressing it at the same time. Okay, so now I go in with a refining tool so we can refine these beautiful knees. And I like to go in there with a pointier tool because these areas are so tiny. To me, they feel tiny at this point because we've come a long way. We've come a long way. How long was your surgery? How long ago?
It was in August. It'll be 2 years.
Wow.
So what is that? A year and a half?
Yeah, yeah. We were getting there. Yeah. How would you say your knee feels now since you started fasciablasting?
Amazing. I had so much pain, and like you said, it radiated through my entire body. It wasn't just isolated in my knee, my foot, everything.
Yeah. I believe it.
I could squat now.
Yay! That's big.
Yes, without pain.
Huge accomplishment. Huge. And I am going in for the kill for these knees. Yeah. Don't be afraid to get in there, ladies. You know, especially if your surgery was that long ago. If your surgery was just recent, just get clearance from your doctor before getting into, any type of body work into your surgery site. Just get medical clearance to make sure it's okay with your doctor first. Or you can also work with your medical professional as well, so they can teach you techniques on how to approach these areas, these restrictions, adhesions, and distortions, like Ashley likes to call them, RAD. It's in our book. Okay, give me some movement, give me a bend. Perfect, hold. And we're gonna get in there. Just like that. And straighten it out, hold. And the reason why I ask her to bend and straighten is because it gives me more access to get into this knee joint. Because she may feel a restriction when she goes to bend, she may feel restriction here, so then I can go in there and work it. And straighten it out. How's it feel?
Good.
Nice and smooth?
Yes.
Awesome. And then we finish the treatment with a nice flush through the entire extremity. Just like that. And you should absolutely positively apply Ashley's After Blaster Lotion. It has arnica in it, and it's got skin tightening agents that are fantastic for your skin. And I would also recommend to ice as well, because we are causing inflammation. So the last thing we want to put is more heat. We don't want to do that. We want to put ice to calm it. And then the next question I know you ladies are going to ask, is it okay to ice after cupping? If you have stationary cupping for long periods of time and you're just doing cupping, I do not recommend ice. Leave it alone because the body is hot. You're bringing up blood flow. Just leave it alone. If you're using cupping for aesthetic reasons, for a little bit, for a little while, for a few seconds, and then you go in with the blaster, then you can ice. And if you're unsure, you can ask the question again on the below this video, and one of myself or one of the amazing motivators will get back to you and explain it all over again to you if you're still unsure. And that completes our treatment for today, ladies. Have an amazing day.